should stop recognizing them unless a primary angioplasty program is in place. The institution should be de-recognized.
You talked about the number of normal angiograms out of angiograms done. Actually, Rand Corporation came out with a document earlier in US actually. Today's issue is no longer normal angiograms. That is not an issue now. Nobody talks about it. What is talked about is conversion rates from angiogram to angioplasty or bypass surgery. And in centers where interventionalists dominate, the number of angioplasties are unhealthily very high, and surgeon dominates, again same issue happens. In other words, now it's conversion rate, not normal angiograms. Whether it's normal or not doesn't matter.
What Dr. Somraj said is very correct, because most of the time the urge to do a procedure has dominated the need to do the procedure, and it happens both with the surgeons and both with the cardiologists as well. The most important aspect of change that we are going to see in cardiology, cardiac surgery in the next decade is a lot of governmental regulations that are going to happen, because governments are interested to put more and more government hospitals of the nature of like All India Institute of Medical Sciences. It is envisaged in the next 5 years there are going to be 35 All India Institute of Medical Sciences being set up, which would be competing, like the health minister has said himself, every district they wanted a NIMS, but where do we get the personnel? So to train personnel, like Dr. Somraj said, to train people in technical aspects is one aspect. To train them to be ethical doctors is the most important aspect. The second aspect, what Dr. Patricia said, was the outreach of rural treatment is most important in cardiology, cardiac surgery, especially in the preventive care. We have seen a sharp decline in this country of rheumatic heart disease by preventive cardiology. And I think preventive cardiology should take a higher step than interventional cardiology to educate people. We are now inundated with the procedures, both surgical as medical. In 1983, when Dr. Kaul and ourselves, we presented a paper to the ICMR, the incidence of coronary heart disease was 5.5 million. In 1983, Dr. Seth from Escort Heart presented the incidence of coronary heart disease was 25 million. Today, 2012, the incidence of coronary heart disease is 125 million patients recorded. Total procedures has been grown. The total number of cardiac surgeries have not declined, they have grown to become 2.5 lakh procedures last year, and angioplasty is 3.5 lakh procedures last year. So the pressure on the physician and the surgeon is enormous to deliver. The volumes are enormous, and when the volumes are enormous and the quality comes down, and most important thing is preventive cardiology as a tool to arrest the progression of disease in the next coming generations will at least try to show a favorable trend in reduction of disease, even though the population growth is there. But along with that, if cardiologists sincerely put their efforts in preventive cardiology, and also like Dr. Prasad was telling, the heart failure treatments are most important now with a integrated approach. Digestive therapy and all these things. And for them, we need to find, like, Dr. Somraj did a pioneering thing about the stent. And we also need to put our resources put together to develop our own devices instead of importing devices, because we have the technology to send a missile to the moon and also beyond to Mars. So there's no dearth of talent in this country to develop our own cheaper devices to help people where they can be treated at a fraction of the cost. I think we need to look at it.
We'll have another.
On? Yes, and along with the discussions that have been taking place, I was very interested in this discussion of setting up AIMS-like facilities all over India, looking at district hospitals as being able to serve people. I think that this is, at the district level, simply going to take years and years and years. Why? Why do I believe this? We go back to what Dr. Somaraju has said. It's a question of ethics. We can't even man primary health centers. Why don't we man primary health centers? Well, we have a doctor there, but he goes into Hyderabad and practices, or goes to a district town and practices, and he buys off the DM&HO with a bottle of whiskey. Now, these are things that I see. The profession has sunk, and I don't mean to be brutal or tactless, but I'm out there, and this is what I see. Friday, I was in a, quote, district hospital. It cannot even do an emergency cesarean because they have no anesthetist. So what are we looking at here? We're not able, and we will never, not for many, many years to come, will we be able to set up good district hospitals with people who work. Again, on Friday, I was in Mehbubnagar District Hospital. I went to the superintendent's office. Who do I see there? I see the DM&HO from another district. I had been trying to get a meeting with that DM&HO from that district. No, I'm off to Tirupati, he says. No, he was with his friend who's from his village, who is the superintendent of Mehbubnagar District Hospital. Until everybody feels the ethical basis of their profession, we are not going to move forward. Not in the way where we have the potential. We have the potential, but it starts with the individual person, not trying to be a little richer than the next cardiologist, have a little more fame than the next cardiologist. We need to look at jobs, and we need to do them sincerely. And what I am seeing today is neither sincere nor ethical. I should not have to go to the head of Arogya Shri and beg like a dog to get a 2-year-old child's bone tumor operated because it isn't covered by Arogya Shri. I should not have to do that. We need more sense and sensibility and ethics right through the entire medical profession. So I'm sorry if I've offended any of you, but this is what I see from my patch in the middle of a notified rural district. Thank you.
So I think it's getting delayed for lunch. We'll conclude the session. I request Dr. Pat Bidinger to come out to the dais to give a memo to Dr. Somaraju, the Asker, and